Okay, so the client has consented to the sterile water papules for lower back pain relief. So the first thing we're going to do is gather our supplies. We need gloves, so sterile water, tuberculin syringe, alcohol prep pads, Band-Aids, a bit of gauze, a sharps container, and also hand sanitizer, which I'm going to use right now to clean my hands before I begin. And the first thing I'm going to do is I'm going to draw up 0.6 mLs of sterile water. I'm doing 0.6 mLs because each location is going to, at each location I'm going to inject 0.15 mLs for a total of 6. So that's clean. And now we're going to draw up the water, first injecting air into the vial. Air is injected, and then going to 0.6 mLs. Taking care that there's no bubbles in the syringe, and there's not. And I'm just going to slide the safety up and over that. The next thing I'm going to do is have the client get into position, which would be a forward-leaning position that's well supported. So I have the client in a modified hands and knees type position. They're on their knees, but the top of their body is draped over an exercise ball to support them. And I'm going to feel on their lower back for the appropriate injection sites. And this is a diagram of what we're looking for. The location of the injections are at the juncture of the iliac spine and the sacrum, those two. And then the other two are just inferior and medial to those other points. Once I have located those points on the client's back, with their consent, I could mark with a marker or a pen the location of the injection, and that would just be so that I can efficiently and effectively do the injections in the moment. So I've got those spaces marked. I am going to clean my hands again before putting on my gloves. So I have my gloves, and now I'm going to prepare to do the injections by cleaning the 4 injection sites with circular and outward cleaning motion. I'm going to do all 4 sites. And then I will have my needle. With my non-dominant hand, I am going to spread the skin taut. And with my dominant hand, I'm going to hold the needle at approximately a 10-degree angle. I'm going to insert the tip of the needle bevel side up, just under the skin, enough so that the bevel is covered. I should be able to see the tip of the needle underneath the skin. And then I will inject 0.15 mLs of sterile water, watching for real formation and blanching of the skin. When that is done, I will remove the needle and I can lightly dry with some gauze, and taking care not to rub or massage the injection point, and then I would move on and do the same for the other 3 injection sites. Another option would be to have another midwife doing injections at the same time, so we could do the first 2 at the same time and the second 2 at the same time. When that's done, I am going to put the safety over my needle, put it in the sharps container. I can apply bandages as needed to the injection sites, remove my gloves, wash my hands, clean up, and then document the procedure and the results. And that's it.